The vision, a world where all people live free of the burden of drug abuse. This is the Drug Free America Foundation's Pathway to Prevention podcast, where we are committed to developing strategies that prevent drug use and promote sustained recovery. Thank you for not only tuning in, but your continued support and efforts to help make this world a better place. We hope you enjoy this episode. All right, podcast listeners, welcome back to another episode of the Pathways to Prevention podcast. Today, I am joined by my friend Asia Ashraf from Pakistan, and just sit back and enjoy this wonderful conversation as we learn about treatment and substance use disorder. Asia, welcome to the podcast.
Thank you very much, Dave. It's my pleasure to be with you and among all people. Thank you very much for giving me this opportunity.
It is a pleasure. I am so glad that our paths have crossed. For our listeners who are spread around the world, would you mind sharing sort of where you are located and a little bit about your organization and the work that you do?
Thank you. As you mentioned, my name is Asia Ashraf. It spells like Asia and it sounds like Asia. It's Asia Ashraf, and I'm from Pakistan. Pakistan is situated in Southeast Asia. It's like China, India, Iran, and Afghanistan. They're our neighbors, close neighbors. And I'm from the capital of Pakistan, which is called Islamabad. And I am working in a hospital. It is like a Greenfield Hospital of Psychiatry. And my designation is Director Rehabilitation and Consultant Psychologist. And in the field of drug addiction and mental health disorders, I am working from last 17 years. And I'm a Humphrey Alumna. I did my fellowship in substance abuse treatment, education, policy, and prevention from Virginia as a Humphrey Fellow. And in addition to that, I am ICAP-II certified by Colombo and a national trainer for Colombo and UNODC in Pakistan, and international trainer as a DDR trainer for UNODC and WFAD. It's One Federation Against Drugs. And like this is all what I am doing right now. It's a kind of a brief introduction.
Wonderful. And listeners, I am smiling from ear to ear. It is just a delight to be having a conversation with Asia, who's got so much wisdom and expertise. I'm curious, what led you to working in our field or in your current role?
Oh, it's a long story. It's a really, really long journey. It's a part of like the coursework when you do your studies in applied psychology. So it is a part of a course like you do, and you take case histories of the patients who are suffering from substance use disorder. So in the relevance of that course, I visited Sunny Trust. That's an organization where the people who with the substance use disorder, they were admitted. So it was like 2004. It was my first ever exposure with those people, and I was so surprised, like what kind of the disease it is, how it is affecting the individual, how it is affecting the family, and then how it is affecting the community, and what kind of the treatment should be there, and how we can prevent that disease. And in that institute, they were like, they were people who had a very tragic histories. Someone he has just sold his daughter for like just $70, and it was like very, very the hard reality for me. It was really heart-wrenching for me. And then there in the psychosis, one person has killed his brother, and then there's too many things. So I thought like I should be part of this team and I should work and I should contribute to the community. So this was like my first ever interaction with the patient who were suffering from substance use disorder in 2004 and as a volunteer. So I joined the organization as a volunteer. Then I became intern psychologist, then assistant. Then I rose to become head of psychology department and director rehabilitation. I served in that organization for good 14 years of my life, and I learned a lot. And in that time, when I was working with those people, I was always looking for something like what is being done in the international arena, because field of psychology and particularly drug addiction, it was not like you don't have a lot of options. Like you can't go as in America or in other part of the world. There are many options, like you can do diplomas, you can do degree in drug addiction, you can do degree in counseling. There are a lot of opportunities. But for me, there were no many opportunities. So I had an experience of like groundwork experience of like 14 years. And then I got an opportunity to get a prestigious fellowship that is called Hubert Humphrey Fellowship. And I really wanted to know like what are the evidence-based practices in the treatment and prevention. What are the rehabilitation protocols? What are the international standards? And particularly how the gender sensitive treatment is being given and what are the protocols. And with all those things, I went to US for a fellowship. So it's just like, and it was like a very first time when I got to know about Drug Free America Foundation. I got to know about the World Convention Against Drug Policy features. It was like first time I got introduced with like, there is a strong movement and I have a role which I can play in drug policy futures. And then in the particularly I can play a productive role in international drug policy development. So it's just a journey. Currently, I am secretary to the VNGOC board and also a member of Asia Pacific Working Group for the VNGOC. So it's just a journey. It started from here and it went up to this level.
Very impressive and admirable. What I hear is a passion, caring for people, and a drive, a determination to make a difference in this world. So thank you for being who you are and doing what you do. Would you give us a little landscape? What is substance use disorder and treatment like in Pakistan?
Yes. As I mentioned in my introduction, that Pakistan is situated in South Asia. So we in India, Afghanistan, Iran, and China, they're our neighbors. It is very, over geographical location, it is very important. Because, like we share a very long and porous border with Afghanistan. And Afghanistan is unfortunately our world's largest illicit drug producer, as per the report of UNODC. So Pakistan is basically a transit corridor of both illicit drug production and trafficking. So it's the one reason that the drug demand is getting higher is like because availability of drugs is there. So the first important point which we need to understand is the geographical location of the Pakistan. Secondly, as per the data conducted by UNODC, it was conducted in 2012 and the report was published in 2013. According to that data, there were around 6.7 million illicit drug users in Pakistan. And it was in 2013. Now they're conducting a new survey because after that, we never got any other survey and we are not sure, like, because the drug types, they're in number, it's number of person with illicit drug use is really increasing. And in that data, there were people with 4.25 million substance use disorder. When I say substance use disorder, they were the people who really required some sort of a structured treatment. And in that data, they were also found that there were 30,000 people in a year who could get treatment. Just 30,000 people in a year could get treatment, and the number was like 4.25 million. And the women, they were in that data, it stated that 1.5 million, they were women who were using illicit drugs. But UNODC in that report mentioned that the women drug abuse that was underreported and understudied. So it was very important. And after that, there were more other drugs more common. At that time, poly drug abuse is still very common in Pakistan. In that survey, heroin and injecting drug use it was very prevalently used among women. It was more prescription painkillers and opioids and tranquilizers. Among male, it were more opioids and injecting drug use. But currently, the status has been it's like a more kind of a ice pandemic in Pakistan. A lot of young generation, women, girls, and male population, they're using ice. So it's currently ice is a kind of a pandemic. So it's just a kind of a brief background.
Now that was a wonderful, wonderful background. You came prepared. So with the treatment need, the substance use disorder, what does prevention look like? I know in our planning call, you mentioned things used to just be focused on environmental, very general. What can you tell us about that?
You're very right. Because the substance use disorder, it was not like a very top concern at the government, or mostly the work in the field of drug addiction is done by the NGOs. Mostly, they're more active in the field. In the last couple of years, UNODC, they have started working more on prevention. And before that, it was more on a kind of environmental prevention. Every organization, they were focusing just on displaying banners, having stamens, and organizing walks and seminars just for the general community or parental awareness, and doing sort of awareness campaigns in schools and colleges or other education institutes. But now, the UNODC, they have launched proper training of universal prevention curriculums. They are training people from the field. They're training parents. They're giving training to teachers. They're giving training to the media personnel. So it is a kind of a more focused work, which is started quite recently. But before that, the focus was more on environmental prevention, not having a very detailed or rich, and it was more of a kind of or just a warning, kind of advice. And if you would do this, this is going to happen. And utilizing more recovery role models who used to visit education institute or something like that. But it was not very focused, as it has been started most recently in the last couple of months.
That comprehensive approach, training teachers, training parents, the media, that makes me smile, because that is oh so important to have that comprehensive approach. It's so encouraging as well to hear the change that you all are making. Do you have credentialing as well? I think we had talked about that.
Yeah, I mentioned that I'm an internationally certified addiction professional, level 2 from Colombo plan. And it's like kind of a credentialized individual. And in Colombo plan, because Colombo plan, they also have done a lot of work in Pakistan. In 2012, they started first time training up addiction professionals, training and credentialing up addiction professionals. So now we are UNODC and Colombo plan, they're training a lot of addiction professionals in the field of treatment. And I'm also ICAP-II certified. I am the recovery alley trainer by Colombo plan.
Wonderful. Wonderful. I will put a link with this episode so our listeners can learn more about the Colombo plan. I would love to talk about international drug policy and how that is impacting substance use disorder, addiction, treatment, and recovery in Pakistan. What are your thoughts there?
Yeah, as I mentioned, my first ever exposure in the international arena was in 2012. when I first time attended a forum, it was organized by World Federation Against Drugs in Sweden. So it was the first time I heard about there is role of civil society, and there is the NGOC, and there is the New York NGO committee, and there is going to be any UNGAS or something like that. Before that, it was I was naive. Now, and I can certainly show that many organizations in my country, they were naive. We weren't aware of even belonging to a largest country, and we were just naive. We were not participating. You didn't know anything about international policy. So it was started in 2012, and during my fellowship in America, 2015 and 16, I got to know more about UNGAS. So I was the person who gave a keynote speech in the preliminary session that was organized in February. I spoke about women and drugs in Pakistan and how it is ignored and how it is underreported, understudied. And then I got to know about and I got an opportunity to meet and other people, like-minded people who were really working hard in the field of drug policy, treatment, intervention, and rehabilitation and recovery. So the journey actually started from there. So once there was a CND session, and I was asked by Kevin to talk about cannabis issue in Pakistan, cannabis legalization issue in Pakistan. And I told Kevin, oh, no, this is not a problem for us. We are dealing with so many things. People are so poor, and there are so many concerns like basic needs, like food, shelter, safety, employment. There's so many things. I don't think so that it is a big problem for us. But when I started searching, I started conducting focus groups of the youth, and then I started having literature, and I saw how the situation in my country. I was alarmed. I was alarmed to see that. And then I made a presentation, and I gave that presentation in the CND, and I talked about here the policies, they are actually being developed in the international community. It has a very, very strong influence on the general population. They realize, they glamorize, okay, in USA you can have free access to marijuana, because there are a lot of myths and rumors associated with you can have it's legally allowed. So how it could be dangerous. And when you work with adolescents, it is really, really hard to deal with that. And then when it comes to the gender perspective, what kind of the treatment it should be. So it has a really, really, very strong influence on how things are going in my country, in my region. And there is now online debate. There is the vape use. It is getting very normalized. And then there is a lot of debate on alcohol should be allowed. In this way, we can prevent use of other drugs and abuse of the other drugs. And unfortunately, we do not have a research background as you have in America. So, and in the youth in my country, they are not trained how the CN should be made. They are not very creative. They are not allowed, and their education and grooming does not allow them to make a decision that is wise by evaluating pros and cons. So they just follow and they just normalize it and just glamorize it, and they have a very, their attitude argues it really changing.
Very interesting. You sparked my curiosity when you mentioned the youth. Could you talk more about what prevention looks like with the youth?
Yes. You would be surprised to know that the Pakistan is the 6th most populous country in the world, and we are the 2nd largest country in the world who has the largest youth bulk. And then, because it is a very, like any other part of the world, prevention is really, really, really important for my country. The country who is dealing with so many things, like with political issues, with unemployment, with the long porous border, when there is availability of drug, And then there is like smuggling, and there's too many crimes related with the drugs. And mostly the predators are youth. They are like used, and it's like in the media it's just highlighting the role of, when you are under the influence of some drugs or something, you can hit easily, you're more like a dawn and something. There is too many things. I believe that the burden on the minds of youth in my country is too much. It is really, really hard for them to see. Like, it is really, really hard for them to make a wise decision. There is a bombardment of information through the media, through the industries, through the internet, through the social media, and we really lack resources of a proper prevention. So it is really, really important for the country, the youth of my country, to understand, to have more life skills, to have better grooming skills, to have more sports activities, to have more activities in which their potential can be utilized productively, in which they are aware of, they are more sensitized about the harms of drugs, and they are more prepared to make logical decisions in their life. So it's really important thing, because we can't afford the treatment cost. As I mentioned, there were only 33,000 people in a year, as per UNODC report, who were able to get treatment. And in that report, 75% of the people who were using heroin, they really wanted to have treatment, but they couldn't, because either it was very costly, it was not accessible, or family was not supportive. So we can't afford that the treatment cost. We can't afford the co-occurring damages or consequences which are caused by the drugs. And in youth, if you start early use of the drug, damage is very high. And with the current ICE pandemic, it's the easy prey. They are used, both young girls and boys. They in the universities and in the colleges, even in the schools. Once there was the age range for substance use was like between 15 and 25. It has gone down below up to the level of 9 years. No, we are having the kids, 9 years old kids. They are suffering from substance use disorder. It is not like they're using or they're just abusing. They're with substance use disorder and they need treatment. So prevention is the top most. It's like a very cost effective strategies for us.
I hear the urgency and the importance of prevention with the youth. And I just want to share a quote from a past podcast episode. I believe it was September of this year, 2022. Rima Saade Turk said, "Only prevention can protect the future generations." That just resonated and stuck with me because prevention is oh so important. I'm curious, with the bombardment in the media, the families you mentioned might not support treatment, and the low amount of treatment, the low capacity. What is stigma like in Pakistan as it relates to substance use disorder?
It is horrible. It is horrible. It is like in last couple of years, there is a slight change in attitude and perception of the community, but it is still, community has a very stigmatized attitude towards substance use disorder. For so many years, it was considered more as a moral sin, or the blame was on parents because they were not good parents, and that's why the children started abusing drugs. And it was more like this. And getting treatment, it was even more stigmatized. It was like considered like, oh my God. And then in the whole society, they were not allowing the kids to intermingle with the kids who were using drugs or with who had a substance use disorder, and even who were in the recovery. The family did not allow them to intermingle. And then parents were reluctant. And initially, the parents, they're in strong denial. the whole community or the society or the village, they would get to know that it is that their child is using drugs. But the parents would disagree. They were in sheer denial. It was a more of a collective denial by the parents, by the community. So in that scenario, you can imagine they were not willing to bring their kids for the treatment. And after that prevention, early intervention is the most important part. But they were missing. They were facing a lot of consequences: suicide, depression, psychiatric illnesses, dropouts, and crimes, the involvement of the kids into the crimes. So it was like stigma prevented them for, for getting help. And it was a more a kind of a secrecy coping among the people who were using drugs. And when it comes to the women, it is still horrible. It is still horrible. It is hard for the society to believe that a Muslim woman coming from a community where her role is more of a nurturing mother, and how she could do that. In when it comes to a couple, and then if they both are using drugs, chances for a male to get treatment, they are little higher than for the women. They are unable to get treatment because the fear of losing marriages, fear of losing kids, fear of losing social status, and fear of stigma, and fear of exploitation. And then it's a very complicated situation when it comes to the women even. So stigma is still, we have gone a long way. And in the stigma among the service providers, it's something which we really need to be talked about, because with the relapse cases, when they come back and then the treatment, what they give to the person who are relapsed, it is horrible, really inhuman.
That just makes my shoulders feel heavy, knowing the challenge that stigma puts in front of us. You mentioned that you've made progress, some change with the service providers as it relates to stigma. What have been, say, one or two things that you've done to help shift stigma with those providers?
The most importantly, because like both UNODC and Colombo plan, they launched the training of addiction professionals. So with the basic training in universal treatment curriculums, because there are 8 universal treatment curriculums. So with basic training in those curriculum, it has addiction professionals. They get knowledge about and it's a brain disease, and what kind of the treatment should be there, and the role of the family, how assessment should be done, how the counseling should be provided, and like how to deal with the crisis, and what are the treatment standards, how what we really call as like what is recovery. And with the training in those curriculums, addiction professionals, they're able to grasp like, oh yes, it's a disease, and how it's a disease like diabetes, like heart attack, heart disease. It's just like this. And they are now able to understand that it has an etiological event, and they are able to understand that genes, environment, and a complex interaction, plays a role. So with the training in universal prevention curriculum, now the Pakistani organization, they have a lot of exposure. Like when I became a member with World Federation Against Drug, my organization is very active. It remained very active. And we introduced a lot of organizations from Pakistan to become a member of World Federation Against Drug, to get membership with VNGOC. And now, and with that, with ICAP network, it's an international platform. So now the addiction professionals, they're getting training. They're getting exposure. They get an opportunity to attend, and with the COVID online trainings, virtual webinars, seminars, I believe that addiction professionals, they're getting more equipped. They're getting more knowledge, they're getting training in the evidence-based practices, and it's really changing their mindset. Still, it's a long way to go. Still, inhuman treatment, confrontation, crisis intervention, beating, locking up, it is still there, but it is much better than it was like 5 years ago. It has changed a lot, but still a long way to go.
A wonderful list of resources, and you have been busy doing some great work. It's so encouraging to hear that change is happening. It is happening. It does take time, yes, but it is happening and things are moving forward. It's making me smile over here. I've asked you a bunch of questions and you have shared so much wisdom with us. Before we end our conversation, I just wanted to open things up. What are some other insights or lessons learned that you would like to share with our listeners?
It's the most important thing, because as I mentioned, I'm working in the field from last 17 years, and I am the person who rose up from a very, very grassroots level. So I had an opportunity to work with women, with adolescents, with elderly people, and then my experience as a Humphrey Fellow and in the international arena as a VNGOC secretary and in the drug policy, it has given me a very good insight. And then I have done a lot of work because I'm also I have launched a virtual platform. It is called Peace. It's a house of peace and tranquility for substance use and mental health disorder. The basic purpose is to build a center of excellence where we can work on recovery, reintegration, treatment, and prevention and rehabilitation. We launched it in the time of COVID. It was online, and I did a lot of volunteer counseling. But now I'm in the coming time. I'm planning to have have its physical existence and provide treatment to those who are suffering and do more prevention and reintegration work. The one area which in the couple of years we have learned something. First of all, it is very much important for us to consider that we need to shift from confrontational approaches toward motivational approaches. Confrontational approaches, they remain a very, very long practicing, which is in Pakistan. They're still their practice, crisis intervention, admitting the patient without their will, without working over them on their motivation and just confining them. It was a very common practice. The first thing we need to understand that confrontation would never work. We need to really, really focus more on motivational approaches. We need to have more trained personnel in motivation interview and kind of a screening and brief intervention approaches. Second, we have led in the last so many years, and it's like evidence-based treatment is very important. A treatment needs to be humane. It needs to be culturally appropriate. This is not like confinement and just like confronting and just like cold turkey and not providing medication assisted treatment. It would not work. It haven't worked in the past, and it is not going to give any result in the future, because we are producing more a generation with resentment. So as soon as they get out of the treatment facility, they start using drugs again. So it is very much to have an evidence treatment protocols. And in the third most important lesson which I had learned in my life is like gender sensitive approach. Like male, it's a disease. It could affect the male. It could equally affect the female. So we need to be very kind and humane toward this perspective. And they need to be provided gender sensitive, empowering, and culturally appropriate treatment. And then the focus should be more on empowerment, that is emotional empowerment, psychological empowerment, economic empowerment. And instead, it should be not on just giving them shelter or just providing them a mixed treatment, because there's so many specific needs of the women, like trauma, abuse, that needs to be addressed specifically. So it is the dire need of time that they should be a separate and there is an urgent call for women or gender sensitive treatment. And lastly, the thing, it is very important is like prevention is prevention, and prevention. I would say like it is, it's a common saying like prevention is better than cure. Yes, prevention can save us from a huge costly prevention can save us from long-term consequences of the substance use. Prevention can reduce the crime rate. Prevention can prepare a healthy and productive youth who can play a really a productive role in the community. So prevention is key. So we need to focus more on prevention, and it should not be a, and when I was in America, I did my internship with CADCA. I'm sure if you're aware of CADCA, it's a community anti-drug coalition against substance use. And it was really, I did its internship with CADCA people. And I was really happy to see how they are like involving parents, different stakeholders of the community, teachers, the spiritual leaders, and politicians, and how they were developing in a coalition, and then the coalition was taking that responsibility, because it takes a whole village to raise a child. It just one organization, one person, one government. You just can't play a role. It should be a collaborative effort of the community, of all the stakeholders. So it's a community collaboration. It is very, very, very much needed. I learned that approach. I really wanted to reciprocate that approach in Pakistan, because it requires a lot of financial resources. It's still in the pipeline of INN, because mostly the funded behind the UNODC and Colombo plan and any other opportunity there from INN. So I'm hoping that we can have a community coalition in Pakistan. It would really, really help, because culturally we live in a joint family system. So it is just how we need to sensitize the community to play a productive role. And once they're sensitized, they would be like real heroes. They would be willing to do a joint venture.
Marvelous wisdom. And I know I said this was the end of the conversation, but goodness, can you tell me more about Peace In? It sounds fascinating.
Is, everybody has a dream. So when I entered in a field, there were some dreams. I had a hope. I had a passion. I wanted to have a treatment facility or an organization or a setup where the environment is very peaceful, very calm, very motivational, very humanistic. And it is more toward empowerment. Because every human being is blessed with the potential. We just need to help that individual so he or she could explore that potential. So the idea of peace, in just as the name says, it's a house of peace and tranquility, where like people are treated non-judgmentally, with love, with unconditional positive regard, where the focus is more on empowerment and community reintegration. I was the person who created first ever recovery club in Pakistan, with the idea that there should be some sort of the people, because the people who are able to get treatment and they're lucky, when they leave the treatment facility and they go out, there's nothing. They're just lost in the system, in the community, and then they relapse. So Recovery Club was the place where I wanted to have an open, free, safe space for the people who are in recovery to just come whenever they wanted to, and they can talk to each other over a cup of tea or coffee. So this idea further stimulated my dream of peace, that there should be treatment. They should be focused on intervention. They should be focused on it should be an institution where there is a capacity building of treatment providers, and we can do a strong work. There should be an advocacy at a local level, at a national level, at a regional level, and we can play a productive role in international drug policy, because whatever the policy is being developed, it affects us. It affects me. It affects the youth of my country. It affects every person of my country. So the peace is this idea, and I hope you would see it soon.
Peace In sounds Beautiful. Beautiful. How can our listeners learn more about Peace In? Do you have a website or social media where we can connect with you?
Yes. We have a website. We do have a Insta page. We have a Facebook page. And then I'm also currently, I am working as the Director Rehabilitation and Consultant Psychologist at the Greenfield Hospital of Psychiatry. We also have a Facebook page, and it's the link of Greenfield Hospital of Psychiatry. And Peace is in and in the Peace in, we are going to have a global recovery movement. So the people who are in recovery, we are going to give them a platform where they can share experiences. And in addition to that, we are going to have a global community of volunteers. So the volunteers from every field, if they're parents, if they're teachers, if they're just elderly people, or if they wanted to give back to the community in any capacity, in writing, in podcasts, in webinars, in training, in whatever the capacity. So it is going to be a very huge volunteer network. So I would request people to join our volunteer network, to be with us and support us. It's just support is not always in terms of money. It is in terms of like training. It's in terms of presence. It's in terms of training, empowerment, and it's in terms of just presence.
That is incredible. And you are incredible. You are no doubt making life in Pakistan safer and better for everyone, but also you're having an impact making this world a better place. I can't thank you enough for taking time out of your busy schedule to have this conversation with me and share your story and your wisdom with our listeners. It has been an absolute honor and pleasure. Thank you.
Thank you very much, Dave. It was a privilege for me that you have invited me to talk about my experience, my dreams, my aspiration, the work I am doing. You have given me an opportunity to expand that work, to expand that network. So it's just, I'm heartily obliged. I'm humbled. So nice of you. Thank you very much.
Together is better. Well, I will put links to Peace In, to the hospital and Colombo plan, ICAP. Listeners, look at the show notes to get access to those links and get connected online with Peace In. Some beautiful work going on, and we can all be a part of it. Thank you again.
Thank you very much. Thank you. I'm humbled. Thank you very much.
That concludes this episode. Thanks for tuning in. Be sure to hit the subscribe button and share this episode with a friend before you leave. And we look forward to seeing you on social media, because prevention is better together. Together, we are stronger.